Vitamin A is a fat-soluble nutrient essential for vision, immune function, and cellular growth. It is primarily stored in the liver, which can maintain the body's need for up to 2 years. Importance of vitamin A. Vision. It is a critical component of rhodopsin, the protein in the retina that allows you to see in low light. Immune system. It maintains the integrity of mucosal barriers, skin, lungs, gut, and supports the production of white blood cells to fight infections. Growth and reproduction. It is vital for skeletal development in children and organ formation in embryos during pregnancy. Skin health. It regulates cell turnover and is used to treat conditions like acne and psoriasis. The journey of vitamin A from ingestion to its site of action is a highly regulated multi-step process involving specific transporters and conversion into active metabolites. Intestinal digestion and absorption of vitamin A. Vitamin A is ingested as retinal esters from animal sources or provitamin A carotenoids like carotene from plants. Hydrolysis of vitamin A. In the small intestine, pancreatic enzyme like pancreatic lipase hydrolyze retinal esters into free retinol. Micellar formation. Retinol and carotenoids are packaged into mixed micelles with bile salts to reach the intestinal cell wall. Cellular uptake. Retinol enters intestinal cells enterocytes primarily via passive diffusion at high doses or protein-mediated transport possibly via RBPR2 at dietary levels. Carotenoids enter via the SRB1 transporter. Enterocyte processing and lymphatic transport of vitamin A. Once inside the enterocytes, the nutrient is prepared for transport to the liver. Reesterification. Retinol is bound to cellular retinol binding protein 2 and converted back into retinal esters by the enzyme lecithin retinol acetyl transferase. Chylomicron packaging. These retinal esters are packaged into chylomicrons, that is large lipoprotein particles. Lymphatic exit. Chylomicrons are secreted into the lymphatic system and eventually enters the bloodstream. Hepatic storage and systemic release of vitamin A. The liver acts as the body's main reservoir for vitamin A. Liver uptake. Chylomicron remnants containing the vitamin A are cleared from the blood by liver hepatocytes. Storage. Retinol is transferred to hepatic stellate cells where it is stored as retinal esters in lipid droplets. This allows the body to maintain normal blood levels for months even if dietary intake is low. Mobilization. When needed, retinal esters are hydrolyzed back to retinol and bound to retinol binding protein 4 for release into the blood. This complex further binds to transthyretin to prevent it from being filtered out by the kidneys. The delivery to the site of action. The final stage involves delivering the vitamin A to the target tissues like the eye or skin. Receptor binding. The retinol binding protein 4 retinol complex bind to a specific cell surface receptor called STRA6 that is stimulated by retinoic acid 6 on target cells. Transmembrane pore. STRA6 acts as a pore that allows retinol to pass from the extracellular carrier into the cell. Intracellular activation. Inside the target cell, retinol is converted into its active forms. 11-cis-retinal used in eyes for vision. Retinoic acid used in most of the tissues to regulate gene expression.
Retinol is transported in the blood by the RBP4 TTR complex. At the cell membrane, retinol enters through its pore and is converted to oxygened.
Vision. The visual cycle. In the eye, vitamin A functions as the chromophore, the part that detects light. Active form. 11-cis-retinal. Process. It brings to the protein opsin to form rhodopsin in the rod cells of the retina. Reaction. When light hits the eye, it causes levensis retinal to flip into all-trans retinal. This change in shape triggers a nerve impulse that the brain interprets as vision. Regeneration. In the dark, the process reverses so rhodopsin can be used again. Gene regulation and cell growth. Most other body functions like skin health, immune response, and embryo development are controlled by vitamin A at the genetic level. Active form: all-trans retinoic acid. Process: retinoic acid enters the cell nucleus and binds to specific receptors called retinoic acid receptors and retinoid X receptors. Reaction: once bound, these receptors attach to DNA at specific sites called retinoic acid response elements. This turns on or turns off thousands of genes that control how cells grow, divide, and specialize. Skin and immunity. Epithelial maintenance. It stimulates the production of keratinocytes, skin cells, and fibroblasts, collagen-producing cells, which keeps the skin thick and protective. Immune response. It promotes the production of mucus in the gut and lungs and regulates the development of T cells and B cells which fight infections. Sources of vitamin A. Vitamin A exists in two main forms in the diet: preformed vitamin A retinoids, provitamin A carotenoids. Preformed vitamin A retinoids found in animal products and already in active form. Best sources: beef or chicken liver, cod liver oil, fatty fish like salmon, mackerel, eggs, dairy products like milk and cheese. Provitamin A carotenoids: plant-based pigments like beta-carotene that the body converts into active vitamin A. Best sources: orange and yellow vegetables, carrots, sweet potatoes, pumpkin, dark leafy greens, spinach, and fruits, mango, papaya, apricot. Vitamin A should be balanced and not consumed in excess. Risk of imbalance of vitamin A. Too much can cause toxicity leading to liver damage. Too little can cause deficiency leading to many problems. Therefore, the balance is necessary. Early signs of vitamin A deficiency: very dry eyes and reversible night blindness, that is difficulty seeing in dim light. Severe impacts of vitamin A deficiency: progression to xerophthalmia, drying of the cornea, beetroot spots, foamy patches on the eye, and eventually permanent blindness. Other issues of vitamin A deficiency: thick, scaly skin, hyperkeratosis, stunted growth in children, infertility, and a significantly weakened immune system leading to frequent infections like measles or pneumonia. Excess of vitamin A. Because it is fat soluble, excess vitamin A builds up in the liver rather than being excreted, which can be toxic. Hypervitaminosis A. Acute toxicity: sudden high doses of vitamin A, nausea, vomiting, dizziness, blurred vision, and increased pressure in the skull. Chronic toxicity: long-term high intake of vitamin A, liver damage, bone thinning, that is osteoporosis, leading to fractures, hair loss, cracked lips, and severe joint pain. Pregnancy risk: excessive intake of vitamin A, especially from supplement or liver, can cause severe birth defects. Vitamin A is a fat-soluble nutrient that requires a careful balance because your body stores any excess in the liver rather than excreting it. Achieving this balance means getting enough to support critical functions like vision and immunity while avoiding toxic buildup from overconsumption. Why balance matters: to prevent deficiency and to avoid toxicity. Plant-based carotenoids like beta-carotene in carrots are generally safe because the body only converts what it needs. In contrast, preformed vitamin A retinol from animal sources like liver or supplements can easily reach toxic levels if overconsumed. Recommended daily intake of vitamin A. For most healthy adults, the recommended dietary allowance is men 900 microgram RAE, that is 3000 international unit, women 700 microgram RAE, that is approximately 2333 international unit. Tolerable upper limit 3000 microgram RAE. Exceeding this daily from preformed sources is considered potentially harmful. How to maintain balance? Prioritize food, limit liver intake, supplement with caution. Only take vitamin A supplements if diagnosed with a deficiency by a healthcare provider. If you take a multivitamin, check the label to ensure it doesn't push you over the 3000 microgram upper limit.